Charles, and I'm one of the surgeons at Southpaws. Today we are doing a Brachycephalic airway syndrome in a dog, and we're live streaming from my phone. So we're starting off with a wedge aloplasty. We can see that the nares are quite narrowed in this patient. We're also going to do a folded flat palatoplasty, and we are going to do laryngeal saccules as well. So first thing that we're going to do, Chris, come around my left-hand side, please. And I'm going to put in a little stay suture here. And this is something that I've just started doing recently, where I put a stay suture in first, use that to retract dorsally, and then I use the retraction to cut my wedge in the alar fold. So if you haven't done so already, please subscribe to our channel and make sure you turn on notifications. So you can see now when we have that stay suture in, what happens is that you can really retract that up dorsally. You can come around the side completely, Chris. Retract that up dorsally, and that allows me to get a much deeper wedge, and you have to make sure that you get quite far in with your wedge trochleoplasty. So I'm starting my wedge right up here. And all the way into the nasal cavity there. Continuing my wedge down there. You see I've taken quite a deep wedge of tissue. Just like that. And now I can use my stay suture, and I'm going to use that to suture the wedge closed, and I can do that in a simple continuous fashion. And if you use your stay suture, that allows you to get quite a bit farther into the nasal cavity when you close. The other benefit of using the stay suture is that it's going to help decrease hemorrhage as well by keeping tension on that. So you can pull on that a little bit more. Okay, so we'll just cut the stay suture out, and I'm just using my suture tag now as my stay suture. Or I'm not cutting the stay suture out, I'm just cutting the tag on it. And now Chris is retracting that dorsally.
Charles, this whole video to make sense plan, so she's really reacting to that.
Yep. You can turn up to 2.5 if you like on the eyes there. And she's on 2 months of fence?
She's on a 2 month schedule.
Right. Do you want to put her on a fence CRI or?
Either that or give her another bolus, whatever you prefer.
That's fine.
Another 2 month bolus?
Sure. You can see how nice and cosmetic that closure is. Tangled my sutures here. And that's the first side. And then we repeat the same thing on the other side. You can get an idea of how far, if we come around the front, you can get an idea of how far we've pulled that over. I'm taking my wedge quite deep into the nasal cavity and the nasal opening.
Charles, are we fixing all three components? Just the question.
Yeah, we are fixing all three. I can only assume, I haven't had a look at the saccules yet, but I can only assume that they are everted. So my assumption is that we're going to be doing all three procedures. Switch. You can pull up on that, please, Chris. And these stitches generally do not have to be removed. The dog usually dissolves them and then paws them out at some point.
Charles, with another question. What's your suture material of choice for this procedure?
So I'm using 4O PDS. Any kind of monofilament would be fine. Monofilament absorbable. I like PDS because it's, it's good for everything. We use it for almost everything at our practice because it has the longest absorption profile of any absorbable suture. Not to say that you need a long absorption profile here, but if you're only going to pick one suture, PDS is the one to go with, or polydoxanon of some variety.
another question, Charles. Do you sometimes use the laser for this?
If I had a laser, I would use it. I don't have a laser. And I've thought a lot about getting one, but I just haven't quite haven't been convinced enough that it's worthwhile getting. I think for staphylectomy, laser would be fantastic. In the US, I know they use them for declaws in cats because as horrendous a procedure as that is, I think that they are less painful when they use a laser. So airway surgery would probably be the most common application of laser in dogs, in my opinion. The other thing that you can do with laser is turbinectomy, because some brachycephalic dogs have really distorted and abnormal turbinates in the back of their nasal cavity, and so people will go in and actually, they'll CT them first, and then if that's contributing to the clinical signs, they'll go in and take out the turbinates using the laser. So that's all finished there, and you can see that we've really opened up the airway. If you come around the front, really opened up the airway, and there's almost no bleeding now because the closure, when you use that stay suture, you're able to close a lot more accurately. So now we're just going to open up the mouth here and have a look at the soft palate and decide whether we're going to do a ligashore palatoplasty or if we're going to do a folded flat palatoplasty. You're probably going to lose your, Demi, you're going to lose your SpO2. Yeah. So I'm just having a look down the airway here. And the dog's pretty light, just be aware of that. So I'm just pulling that soft palate out. Clearly it's redundant and it's really thickened in there. You can see how thick it is there. So I'm just going to, can I get you, Chris, to pull the tongue out, please?
Just another question. It's a dental rack used in rabbits, someone's asked.
This is a dental rack that people use in rabbits, yeah. And I happen to teach a course, and the company had them just for the cadaver dogs that we were teaching the course with. And I took one look at it and said, that is fantastic, and I'm going to use them for my airway surgeries, and they're really, really good. So I'm just going down and getting an assessment of where that caudal end of the palate is. It's coming right up to about here. So I'm going to make a mark using my electric cautery. And so that's as far forward as I'm going to take my palatoplasty. Coming out to the sides.
It's just another question from someone that's recently joined, if you can recap on what we're doing.
So we've just done a stenotic nares and a brachycephalic airway dog, and now we're doing the soft palate, and I'm doing a folded flat palatoplasty. And then we're going to look at the saccules as well. And dog is breathing up a little bit, so.
And someone else has asked if you can go over the anesthetic protocol.
So the anesthetic protocol, we would have pre-medded with acepromazine and methadone? Just acepromazine, and now we're doing fentanyl boluses during the procedure. And
Zoom before you cut as well.
all right, so that's the soft palate there. That's the cranial or rostral margin of my folded flat palatoplasty right there. I'm going partial thickness. Basically, I want to go all the way back through to the nasopharyngeal mucosa.
Do you want to talk about the rest of the anesthetic protocol?
Yes, please.
So we do, it's a clopramide subcut,
So metoclopramide subcut.
and then your metoclopramide IV as a CRI.
So IV metoclopramide as a CRI.
And then they have pantoprazole IV.
Pantoprazole IV.
And then they have methylpred post-induction.
Methylpred right after induction.
And then we just ice the soft palate.
And then we ice the soft palate until before and after we do the procedure.
Just another question, Charles, about how often there's respiratory distress after the procedure.
So these guys generally do not have a lot of respiratory distress. Can I get a lap sponge, please?
Yeah.
If they're not severely affected beforehand, then they're generally not going to have a lot of problem afterward. Sometimes if you have dogs that are really like cyanotic, basically, when they come in, they're the ones that are really going to struggle post-operatively. And I'm just packing some laparotomy sponge in the back of the throat. Did you lose the tongue? I've got I'll remember these. So I'm just packing some gauze swabs in the back of the throat here. I'll just make sure that I pull those out when I'm doing my...
How many you put in, just one?
A few.
Okay. Purple are the longer ones, but they're both the same. Yeah, same with the shoulder width.
Camille? I need bipolar, please.
Bipolar, please.
I'm just going to get bipolar cautery because with the bleeding that I'm getting, I'm having a hard time getting the cautery to work because monopolar cautery does not work in a liquid medium, whereas bipolar does.
The cautery is on very low as well. Oh, it's on 0.
Coag was on.
3.
Yeah, that's all right.
It's on 35, do you want it lower?
Yeah, no, that's good.
Just another question, Charles. Do you use decongestant spray with epi to control bleeding at all?
I have not used that in the past. We're getting some swallowing, Tammy.
Someone's just made a comment about noticing the ET tubes out of the way.
Yeah, so it's just a small ET tube just because this is a brachycephalic, so their airway is going to be smaller anyway.
And someone's just asked if there's a specific diet that we do post-op.
We keep them no food and water for the first 12 to 24 hours after surgery. And then we're happy to feed them normally. We do send them home on omeprazole. Can I get suction going, please? And we're still swallowing here. Demi? Can I get some suction, please? And a yank our tube, please?
Yep.
Just another question, Charles. Is this routine prophylactic procedure of a certain age for this typical breed, or only fixed when there's a problem?
I'm in the middle of some bleeding right now, so I'm not going to be able to answer your questions at the moment. I reckon I'm going to convert this. Let's see here. So I've gone into the nasal cavity there. What section, please? Right down there. So it's in section quite aggressively in there. So now I'm just going to suture the corners of my palatoplasty up. I'm sorry, I wouldn't be surprised if your view is not great from the...
Someone's just asked what the risk of aspiration is post-op.
Aspiration is reported as a risk, but I haven't really seen it in these guys. So I don't think it's a major risk. You can get nasal reflux if you go too far forward, but again, that's not something that I've seen clinically. You all right there, Chris?
Yeah.
Can somebody let them know that we're recording it? We'll just look.
And someone's just asked if we're using PDS for this procedure as well.
Yep, so PDS for the palatoplasty as well as the nares. Let's see if I can clean up a little bit of the blood so you maybe can get a better view down there.
Someone's just asked if we always do extraoral intubation as well.
We always do intraoral intubation, so just regular endotracheal intubation. I'm not sure if that was the question. But we do transoral intubation on these guys. We never do tracheostomies. So now I'm just going to come down to the bottom of my palletoplasty and start my continuous suture line.
Someone's just asked if you don't have to do a folded flap, can you use ligashore to cut the soft palate in that case you don't have to suture it anyway?
So I almost always do a ligashore palletoplasty, like you're alluding to, but this dog, the soft palate was so thick and meaty that I've decided to do a folded flap instead. But I almost always do a ligashore. Now I remember why.
And someone's just asked which are your anatomic marks for the size of the staphylectomy.
So the staphylectomy, basically you grab onto the caudalmost portion of the soft palate and bring it cranially, bring it rostrally, and wherever it wants to lie up against the roof of the hard palate or the soft palate, the roof of the mouth, that's where we start our staphylectomy. So that would be the cranialmost, and then we basically cut an ellipse using that as the rostral or the cranial end of the excision.
And just another question, any sort of block or analgesic used to reduce pain and irritation to the mouth post-op?
We don't use any blocks, and the reason why I don't use a block, normally that would be a good idea, but I don't want to relax the pharyngeal muscles, because these guys, if you relax the pharyngeal muscles too much, then they'll really struggle to breathe afterward. So I don't want to use anything that's going to cause too much relaxation. Such a deep hole, I almost need flex decks to close this.
One day.
Yeah, they do intralaryngeal surgery in humans with Da Vinci. And the next question is whether we would do a tonsillectomy. And I would not in this case because the tonsils are not impinging on the airway, but some cases when you anesthetize them and you look down there, the tonsils are really big and kind of interfering with the airway, and we'll go ahead and take them out at the same time. So I finished my continuous suture pattern, and then we're going to extubate in a minute to do the sacches. Unfortunately, I don't think that on the live stream you're going to be able to see it because it's such a deep dark hole. I can barely see it myself.
Someone's just asked for inflamed tonsils that we don't take out. Do we recommend any anti-inflammatories?
If you have inflamed tonsils, you certainly could do anti-inflammatories or antibiotics. I've gotten them all out, I think. Yeah. Okay. No, we're all good.
Beautiful.
Yeah.
Yeah, look really clean.
Alright, so now we're going to have to extubate, and I don't think you guys are going to be able to see very well. So we're going to go ahead and end the live stream. I hope to be streaming some other stuff this afternoon, so stay tuned. Thank you very much for watching, and if you haven't subscribed, please go ahead and do so, and we will talk to you soon. So go ahead and hit the end.